I'm going to thank the Chairman and committee members for the invitation to meet with you to discuss our implementation of the EU Digital COVID Cert, and you've already introduced my colleagues, so I won't repeat that. So I'm chair of the ad hoc subgroup of senior officials on COVID-19, and the group is established to monitor and update the government on all operational risks associated with the implementation of the EU Digital COVID Cert and the public health risks associated with the easing of restrictions, particularly in light of the progress of the disease and the emergence of variants. So as you know, the EU Digital COVID Certificate Regulation entered into application on the 1st of July 2021. It was developed to facilitate safe, free movement of citizens in the EU during the COVID-19 pandemic, and the European Commission has built a gateway through which all certificate signatures can be verified across the EU. On the 29th of June, Ireland joined the EU Digital COVID Certificates Gateway, and this means the digital COVID certificates issued in Ireland are recognised by authorities in other EU member states, and that Ireland can verify digital COVID certificates for travellers arriving from other EU member states and apply the public health rules associated with those digital COVID certificates. On the 1st of July, which was Go Live Day in Europe, as a pilot run, Ireland issued its initial DCCs, including the necessary digital signature, attesting to the fact it was issued by the issuing authority here in Ireland. And on the same day, we had a team working at our ports and airports verifying QR codes of travellers. On the 9th of July, Ireland published its travel rules, one of only 4 countries to do so at that stage. So implementation of the EU Digital COVID Cert cuts across a number of government departments and agencies, as you know, and the challenge has been that many of the relevant departments and agencies are involved in related COVID-19 projects, policy and legislative developments which connect with the implementation of the Cert. So the role of the group has been to develop a unified project coordinating our respective efforts from colleagues around the system to identify some of the potential risks and gaps and to progress mitigations and alternative solutions to identified gaps and risks. And thanks to my colleagues right across the civil and public service, we have made good progress to date on implementing what is a very large and complex programme that has required delivery in a very tight timeline. And on their behalf, I will give you a brief overview of the approach been taken. So our primary focus was to fulfil our EU obligations in a robust and effective way, including operability by the 1st of July in the context of EU compliance and delivery of certificates to eligible members of the public in line with the government's proposed lifting restrictions on non-essential travel on the 19th of July. And in doing so, we had to be very mindful of developing the certificate in a way which provides the greatest assurance in line with data protection as regards sensitive personal information. And a group involving the relevant departments and agencies, many represented here today, have been meeting regularly in plenary session to deliver on the project since the end of May when the government agreed the group's establishment. So first of all, in terms of generation of certificates, in light of the significant pressures on the Health Service Executive and particularly ICT teams following the cyber attack, the Office of the Government Chief Information Officer has undertaken the certificate generation process on behalf of government. DCCs for vaccination and recovery are being produced by the OGCIO using data provided by the HSE. Vaccination certificates are being pushed out. This approach is enabling us to get certificates to as many people as possible, as quickly as possible. In respect of vaccinated persons, where a verified email address is available, that's mainly those who registered on the vaccine portal, the vaccine certs are being sent out by email. And where no email address is available, vaccine certificates are being posted out to home addresses, mainly those vaccinated through their GPs. Where there is insufficient contact information to send out a cert, a call centre will be available from the 19th of July, through which a vaccine cert can be requested once a person's identity and eligibility have been verified. As regards persons who are recovered from COVID-19, recovery certificates will also be available upon request through the call centre, subject to verifiable evidence of recovery from a prior infection during the previous 180 days. An upgraded version of the COVID Tracker app will also be available shortly, and this will allow people to upload their certificate, paper or PDF, to a wallet on their phone. The COVID Tracker app, as you know, serves as a pandemic response tool and currently carries a number of functions. These are independent of each other, and it will be possible for people to disable those features and use the tracker solely as a digital wallet to store their COVID cert if they want to do that. In terms of data to support certification, this is the purview of the Department of Health and the Health Service Executive. The HSE has multiple data sources for vaccine and recovery data, for example, the vaccine portal, GPs, pharmacies and other acute hospital settings. and the data quality is varied. So extensive data quality work has been undertaken to ensure sufficient and fully accurate information is available to support both generation and the issuing of certificates to an individual. That work is very well advanced, and as regards 1.9 million vaccinated persons, this data is now available to allow for the generation of these certificates on a push basis. It was necessary to undertake extensive data validation on the vaccination data, as many people did not always provide their full contact details, particularly prior to the public portal. In addition, efforts were made to minimise the number of people who have deceased who would receive their certificate. Work on data relating to persons who've recovered from COVID-19 is also continuing apace. Given the quality of the data and the relatively smaller numbers involved, it has been decided to provide recovery certification on a pull basis, that is, on request. And this will enable us to complete missing data fields, authenticate identity, and ensure address and email for issuing the cert are accurate and up to date. In terms of generation of certificates based on a negative or not detected test, they will be provided through private operators who will meet minimum entry requirements. For example, the use of EMA-approved tests, ID verification process, the use of medical professionals, and data entry requirements. An information notice to prospective test providers on accessing the digital service required to generate the digital COVID cert was published last week, and to provide citizens with an EU DCC COVID-19 testing providers of both NAAT, including the RT-PCR and rapid antigen, will be provided with access to the EU digital test certificate service, which is being operated by the OGCIO within the Department of Public Expenditure Reform. Access to this service will allow test providers to generate EU digital test certs for all negative or not detected test results in line with the national and EU regulations. Approved access to the EU digital COVID test certificate service is contingent on test providers being compliant with the relevant national and EU regulations in respect of SARS-CoV-2 testing, associated public health measures, and the standards and obligations detailed in the standard operating procedure. Prior to receiving access to the service for test certificate generation, providers are required to review and digitally sign the standard operating procedure and return by email, and we've given the reference there. So certs for persons not vaccinated in Ireland. The EU regulation gives the option to issue vaccine certs to persons vaccinated elsewhere with EMA-approved vaccines upon receipt of appropriate proof. The main development focus at the moment is on the delivery of the obligations of the EU regulation in respect of persons who received a vaccine or a test in Ireland. Arrangements for provision of vaccine certs to persons not vaccinated in Ireland, including Irish passport holders vaccinated in Northern Ireland, will be considered once the initial rollout is in place. And discussions are also ongoing between the European Commission and third countries with a view to facilitating interoperability and mutual recognition of certificates. It should be noted that the EU Digital COVID Certificate is not a travel document, and the possession of an EU Digital COVID Cert will not be a precondition to exercise your free movement rights. Therefore, travellers who do not have a Digital COVID Certificate can provide other verifiable forms of proof of vaccination or a valid negative tests. I wanted to mention this morning also the passenger locator form. Passengers entering Ireland must fill in a form before they arrive in Ireland, the COVID-19 passenger locator form, and failure to do so is an offence. The COVID passenger locator form is now an online form, and as of yesterday the 12th, carriers are obliged to check for a completed EPLF form before allowing passengers to board or embark. Through enhancements to the electronic passenger locator form, which are currently under development, travellers will be required to make a statutory declaration as to their travel status, that is, vaccinated, recovered, or in possession of a negative not detected test and form of proof. This determines what other public health advice, quarantine or testing measures will be applicable to the passenger, depending on what country they're travelling from. Once operational, the enhanced EPLF receipt will identify those that have a certificate of an EMA-approved vaccine or recovery or a negative PCR test, or who are otherwise exempt from the requirement to have such a test. For those travelling on a vaccine or recovery cert, no further pre-departure checks are required by carriers. But passengers travelling on a negative PCR test will be required to provide proof to the carrier of a negative PCR test taken within 72 hours of arrival, or will be denied boarding. Passengers arriving from designated states who have pre-booked a place in mandatory hotel quarantine will be met at the aircraft and escorted separately from other passengers through the airport building for check-in as required. Currently, children under age 6 and under do not need to take a PCR test prior to travelling in Ireland, and that age limit is currently being reviewed. So a verifier app has been also developed to support checks of the digital COVID cert, which allows a mobile device, a phone, to scan the QR code on the cert in either paper or electronic form. The Border Management Unit and An Garda Síochána will conduct spot checks of public health documentation, including the digital COVID cert, at ports of entry to the state for the purposes of ensuring the integrity of the enhanced public health travel regime. The verifier app for checking the digital COVID cert is available to the carriers should they wish to avail of it. It's acknowledged there's considerable complexity associated with travel at the moment, given the impact of COVID-19 worldwide, and part of the work of the group has been to provide a unified source of information for the public. There is comprehensive information on both the digital COVID cert and international travel in general on gov.ie/travel and www.dfa/travel, and both web pages will be kept up to date with all of the latest information. A digital COVID cert call centre is being established to take calls, provide support and resolve queries for citizens who have been vaccinated and received certificates. It will also resolve issues for citizens who require a certificate but have not yet received one, or who are requesting recovery certificates having recovered from COVID. The contact centre has been created at exceptional pace to manage the required workflows and communications while meeting all of the data protection requirements. And this has required an incredible effort across multiple government agencies to put in place the people, the processes and the technology required. An interim emergency line will be operational from today, and we are prioritising queries for people who are travelling in the very near future and have received their certificate and may have queries on that cert. A fully capable centre will be available from Monday the 19th of July. This line will be focused on dealing with urgent queries only over the coming days, so we're requesting only those with an urgent query contact the centre this week. The service will be significantly ramped up between now and the 19th, when a full call centre will be available. Meanwhile, travellers can access the most up-to-date information through gov.ie/travel. Data protection has been the subject of an ongoing engagement with the Data Protection Commission to ensure the process is fully compliant with GDPR regulations. The requisite data controller and data processing agreements are in place for any data transfers in respect of the generation of the certificate. All other requisite processor and sub-processor agreements will be in place prior to any further transfer of the data. So as of today, 160,000 paper vaccine certificates were posted yesterday, and they're due to arrive in homes today. Approximately 1 million emails were issued between yesterday and tomorrow, and altogether it's anticipated that over 1.8 million certificates will have been delivered by the 19th of July. The certificates are generated based on the information that's currently available, and there may be circumstances where information needs to be updated on certs, and this can be done through the call centre. A small number of private operators have already signed up to provide DCCs, and further information on relevant providers will be made available in due course. Work is also continuing on making the enhancements to the EPLF for the 19th of July, and the Department of Transport has been engaging with carriers on their role as part of the verification process, and to update them more generally on progress on the implementation of the DCC and the enhanced EPLF. So in summary, progress is continuing apace with regard to the implementation of the EU DCC, and while the challenges involved shouldn't be underestimated, from the technological developments that are required to be stood up at pace, the data governance arrangements and the scaling up of all the operational matters throughout to the end-to-end solutions, we are on track for the system to be operational for the reopening of essential travel on the 19th of July. And I would like to thank all of my colleagues for their work to date. Thank you.